Welcome to Health Tech Heroes, where we talk to innovators who are rewriting the DNA of healthcare. Today, we are excited to welcome Astrid Androsch, CEO and co-founder of two pioneering deep tech companies, QuanBio and RoboCosme. Astrid is transforming industries through the innovative application of AI, robotics, and advanced manufacturing technologies. At QuanBio, she is revolutionizing cardiovascular care with real-time clinical intelligence that enables earlier, more precise decision-making for cardiologists. Simultaneously, her work at RoboCosme is redefining smart manufacturing with AI-powered systems that enable mass customization at industrial scale. With a track record of successful ventures and over 20 years of experience leading technology-driven transformation across healthcare, consumer, and industrial sectors, Astrid brings a unique cross-disciplinary perspective to solving complex real-world challenges. Her career began at Coca-Cola Company, where she held leadership roles across multiple continents, focusing on market expansion, business transformation, and early integration of technology into global operations. Her entrepreneurial journey began with founding ABC Consulting, where she advised major corporations on technology-driven mergers and innovation strategies. Then she moved deeper into tech with an early venture in educational publishing space, marking her first experience scaling software-based solution. Welcome to Health Tech Heroes, Astrid.
Thank you very much for having me here today. Very nice to meet you and have a conversation with you. Looking forward to your first question.
Absolutely. The most important question that I have for you is, you started with the corporate roles in Coca-Cola Company to becoming a pioneer in deep tech entrepreneurship. What inspired this transition? What is into this cutting edge fields of AI and robotics?
Thank you for the good question. But let me begin actually immediately, because you mentioned the word transition. This has actually never been a dramatic transition. In my case, it was literally evolution. My time at the Coca-Cola Company was in fact the best business school I could have ever asked for. As you mentioned, I had leadership roles across multiple continents, but particularly in the earlier days in Central and Eastern Europe, but also in Africa. Markets at that time that were just opening up. And it was all about speed, agility, and building a business from the ground up. So we were not only expanding and entering new markets, but we were literally reinventing operations, creating new products, and changing the supply chain. And it naturally pulled me as an entrepreneur today in the early days in system thinkings and early stage technology adoption. So looking back, the Coca-Cola Company has actually taught me how to think at scale, how to lead under pressure, and how to apply innovation in a pragmatic way, not in a lab, but in a real-world application. So later I launched a consulting business. I advised large corporations on tech-driven transformations and M&A. But again, it gave me an exposure to cross-sector innovation. So taking that learning from one industry sector and applying it in a completely different industry sector, in a way also reshaping legacy industries. And that was then followed by my first venture, which is a digital platform, publishing platform for universities. So it was really for me the first time that I built a product from the idea on paper, from scratch, managing the development, the deployment, the scaling from a big business to a very small business, hands-on, but touching every element of building a business beyond just the technology. But it was the first venture. So for me then in the next stage, it was moving into a robotic. As I said earlier, it wasn't a pivot. It was actually continuum layer by layer. And as such, it was evolution. And now I am in the stage of building businesses. But I continue to go through evolution.
Yeah, absolutely. And the evolution is happening so fast that you are well placed and you have experience on evolution, not just technology. So you know how to evolve, how to change things, how to pivot things. And being in a market, something as diverse as African market and Eastern European market, and having handled that, I think that's going to be incredible experience that you bring into any role that you get into. So you also have a background in psychology, and I was pretty keen on that. And now you're getting into artificial intelligence, right? Now, from psychology to artificial intelligence and robotics. How does that background influence your thought process in these fields?
So actually, some of it was evolution, some of it was also by getting older. But I'm holding 2 degrees. Pointed out psychology, the second one in marketing. However, I have learned actually the most important lessons in the real world. It's real world experience. It wasn't a theory in academia. And especially when I began my career, the world was fundamentally different. There was not global trade of the scale we have it today. The whole landscape was fundamentally different. As you can see, I'm an Austro-American. The European Union, as we know it today, was still in the forming stage and didn't exist until 2007. So the digital infrastructure we take for granted today was not in place at all. And that has changed. And also especially that change has accelerated at a dramatic pace. And it has also shaped for me how I see innovation. It's less from a theoretical perspective, but it's building something. And the same was in the business environment. Build a new idea under pressure across borders. And often before this, and actually often deploy systems before they're ready, go out and just test it. So in any, as you mentioned, the academic background, in any successful career, especially in the field of technology, it's all about adjusting to change. You actually have to embrace it. And ideally, you even go beyond. It's not just embracing, it's seizing the opportunities. For me, the years I have spent in operational and technology-driven transformation on the ground, in different industries, but also in different geographies, has really shaped my thinking more than any textbook ever could. And in my background, I've led large-scale change in very fast-moving environments across industries and geographies, but that has taught me a lot. It taught me actually to see what is coming, to anticipate it, but most important actually to act upon it. And in our field, in the field of technology innovation, it's not enough to adapt. It's anticipating, building, it's scaling, and it's scaling with clarity. And that's the way I actually approach innovation. And I approach it through that lens. And that's what I actually bring to every venture I have.
Thank you. And I want to repeat what you exactly said. It is not enough to adapt. It is important to innovate and scale and be on the forefront. And that is what is the requirement of these times. It's just not enough to adapt. I think that's really key. I have been proposing and I've been a big proponent of adapting as quick as possible. But I think there is a change in my thought process because of that just single sentence. So thank you very much.
You have to seize the opportunity when it is there. When it is there, or in some ways even seek the opportunity, because you have to be the first one if you venture into a new field.
Yeah, thank you very much for that nuance. I totally didn't think about it before. It was a new idea for me, so I appreciate it.
Thank you.
At QuanBio, you're using AI systems and QuanCardio specifically, the platform transforms cardiovascular through real-time vascular assessments. I have 2 questions exactly QuanBio does. How did you come up with the name QuanBio? What was the reason behind it? And just this question for now.
So first question, QuanBio is short for the legal company name, which is Quantum Biotech. And when we started the company, which was at that time idea on paper, we thought about quantum processing, quantum for quantum processing, and bio for biotech. So it was actually a name that was chosen to represent the focus area we actually have. But then as a domain, quantum biotech was not really a good trade name. We shortened it to QuanBio.
Awesome. And a little bit more specific on QuanCardio platform.
So QuanCardio, again, it's the Quan for quantums. We are in cardiovascular, but we are really in a completely new category of tool or platform. And just to make it clear, we're not in imaging, we're not an ECG. What we actually do is we're delivering real-time live vascular interpretation, which is a non-invasive insight into the state of a patient's entire arterial health. So what we actually do is, with a medical device and AI platform, we instantly screen the entire vascular system at point of care when the patient is in front of the doctor for any kind of arterial stiffness, which means it's the plaque buildup inside the arteries. And that is actually the major reason. And then one of the biggest healthcare problems that we actually have today is cardiovascular disease. So what we are doing is putting intelligence in the hand of the clinician so that they have all the data available to make a decision immediately. And so if you look, as I touched a little bit on the problem today is that actually legacy diagnostic machines, they're expensive, it requires the patient to go into another room or even schedule an appointment. They're only used or mostly used for high-risk patients. So actually your insurance wouldn't even pay for them if you don't have severe symptoms. But literally if you have severe symptoms, that means you have 95% plus plaque buildup in your arteries. So it's literally too late. So that's why we at my co-founder, Vlad, who is a cardiologist, actually there needs to be a way of detecting the disease in time because it's treatable. And so that's treatable and detected before any symptoms have appeared or before the major damage to the blood vessel has been done, because it develops over 20 years and most people walk around with quite a level of cardiovascular disease, but they're not aware. So what we then do is now we have developed that solution over the years is we are capturing every single cardiac cycle and the pressure wave that is pushed out and how actually the pressure wave travels through your entire vascular system. As such, we're able to capture very subtle vascular signals. And within minutes of the 3 minutes test, the clinician hears all the data on their screen of 25 plus biomarkers where the patient health is and exactly what the issue is. But then it's rapid decision making based on data, detecting the disease, but then also monitoring the disease, because it's all about personalized intervention and precision medicine. So in a way, what we do, it's clinical or medical intelligence. And what we have developed now is a solution that has been also tested, clinically tested, scientifically validated, and it provides meaningful insight. As you talked about healthcare, and we are here about because of healthcare. It means the patient experience, the visits, it means faster detection, faster answers, and fundamentally better outcomes. For the cardiologist, it means the ability to act immediately instead of also relying on delayed imaging, which actually for most people it is not available because it's neither affordable nor accessible and has never been designed for screening.
What does it take for a doctor to bring your system into their clinic?
Actually, the way we have designed the platform, as I mentioned earlier, it's all about accessibility and affordability. It is a SaaS solution that comes with a very small medical device. It fits into existing workflows. It fits actually into existing reimbursement codes. So it actually solves a lot of other problems for doctors as well, which is risk stratifications and liabilities and enhanced decision making. But we're not a big bulky machine. That is the past. Those are legacy systems. Big bulky machines, very costly, you need to schedule, but we do not replace them. In screening, this is diagnostics. They actually have their purpose and their role in late stage pre-surgery. They're very useful. Our focus is on prevention and early detection and disease management on the one hand, but in some extent we're also creating a funnel into diagnostic. It actually allows the doctor to justify the use of that. I have evidence that there's an issue. Now we actually need to double click on that issue.
One more question on QuanBio, and I'm sure, being in this space, you get to hear a lot of stories. There must be a story that's so close to your heart. Is there a story that you can share with us?
Actually, there's two stories, but the most important one, we have done clinical testing in different locations and also with different patient populations in the United States, especially we did a while ago testing in Mississippi, which is actually, which unfortunately is the epicenter of cardiovascular disease in America. It's because it's the most underserved populations. It's very poor populations. They have multiple comorbidities together. So right now, if you tell a patient who literally is a worker, sharecropper in the Southeast, that they should make an appointment and go for a CT scan, it's almost absurd because not only is there no infrastructure because America's rural systems are completely underserved? It's also not affordable. So what the market really needs for health equity purposes is a solution that is so affordable in the test that is so quick, which actually goes hand in hand. As faster is the test, as lower are the costs, that you can instantly check a patient regardless of their financial situation. It allows more practices actually to adopt it if it is in the low cost price sector, and the doctor make an immediate decision because patients naturally, even if they could afford, sometimes they can't take off another day from work and go somewhere else. And then it takes 2 weeks till the results are coming back and the nurse calls and the data is later. Decision making in today's world is all about when the patient is there. The exact dose and medications you need, the decision needs to be made when the patient is there. A second one is really we work with in the Mid-Atlantic region with top cardiologists, and for him it's more different patient population here in the Northeast, but he says the biggest use case for him, it's really precision medicine, because many times he has two patients that on the surface look the same, both 40-old, similar elevated blood pressure, a little bit overweight, but they look good. Naturally, he would treat them the same. But now that he knows actually one has an arterial age that reflects the biological age, but the other one has an arterial age like 45, but the arteries look like the one of a 60-year-old, that means there's way more damage through the comorbidities. So as such, he needs to treat the second patient more aggressive. Could mean driving down hypertension even by 10 more points. And that's why it is become not the one size solution fits all. That's when it becomes precision medicine.
Next question for you is, as a thought leader in this area, we know AI, healthcare, and manufacturing all are emerging really fast. What do you think the industry is going to look like in next 5 years? What do you think is going to be the most significant change that you anticipate?
So your question is actually related, what is the trend, and the trends will be actually impacting the healthcare landscape in the next years. So from my perspective, the first one is real-time point of care clinical intelligence. As I mentioned earlier, for decades we've used retrospective diagnostics, and that provides snapshots and only applicable when the disease has progressed. And I'm not talking about cardiovascular disease in general. So as a physician today in healthcare, you live in and need a very dynamic environment. You need real-time signals that give you informed treatment decision as the condition evolves. And the shift really requires innovation and AI to move into the space of early detection, whether you're in cancer care, or in Alzheimer, or in any other area of diseases. It's about monitoring, engaging quick, rapid, and fast. And that actually takes me into the second one, which is really the emergence of adaptive and semi-autonomous systems. It's not about replacing the physician, but it's supporting them with an AI layer of helping them to interpret extremely complex physiological data in patterns in real time. It also, these systems reduce then a lot of the overhead and inefficiency in a healthcare system, because it reduces the dependency and optimizes actually an infrastructure, because it's all about fast and more efficient, but yet at the same time it's also about the individualized care. And it's especially important, as I mentioned earlier, in primary care and underserved areas. And that transformation, which is like healthcare, also adopting the principles from manufacturing. It's like robotics, it's AIT 4.0, it's digital twins. They're really moving into the care environment. And that means personalized dosing, just-in-time logistics, and the ability to match production also in a clinical setting. It's, in other words, it's the healthcare, the back end of healthcare also needs to go intelligent and not just on the front end. And ultimately, I see the convergence of diagnostics, of monitoring, and product delivery happening in the same closed loop environment. So it's real-time health data driving real-time responses tailored to a patient, delivered on demand and when needed.
That is going to change the patient experience so dramatically. In next 5 years, you're going into the doctor's office, and 30 minutes later, you know your history, you know where you stand, and you have the treatment plan, and you're coming out without going anywhere else for majority of the patients. And that's what you see in next 5 years, and that will be fascinating.
And we have already begun that journey, and actually COVID, that's the positive side of COVID, it propelled us forward. Home healthcare. People began buying oximeters and taking charge of the healthcare. So it has changed how we think about healthcare. And because of an aging population, home healthcare becomes more and more important. But it can't work without any systems and automation because we don't have the personnel way to handle it.
Perfect. All right. We are getting to the last but one question. And this is you as a leader and a really successful entrepreneur. What advice would you have for entrepreneurs who are just getting into this business where you have such dramatic change in AI and technology and manufacturing techniques?
Yes, actually, in today's world, and especially as we talk here about AI, I would give the advice, forget the hype. Do not start with what is trending, the focus on where did you see the opportunity because something is broken in the system. The real opportunities for innovation are usually hidden in places. And sometimes, like in healthcare, it doesn't feel sexy like other industries. It's complex. It's hard to fit. It's a very, very long road to success. But this is also where deep tech really belongs. If I take healthcare and AI, it's one of our biggest human needs that we have to address with innovation. So if I give advice, both of my ventures started eventually from friction in the real world. There were inefficiencies, blind spots in systems, very outdated legacy products, whether this is the manufacturing or the healthcare side. So my advice is really to young entrepreneurs, look for the friction that others are ignoring, because otherwise you're pushing into a very crowded field that is extremely competitive. And the second one is be also honest about the execution, because even though everybody tries to jump on the train of AI, not everything actually does require AI. So make sure that what you build, you're really building is with substance. Because today it's easy to build something that looks cool, but then later actually collapses in the real world, which is a little bit more devastating in the healthcare world. But finally, it's also my other advice is build it fast, make failures, learn from that failures, but get out, don't hesitate and do it, because real world, eventually it's messy, it's challenging. But if you don't go through these challenges, you can't actually tailor a really good solution. So go learn from failures, iterate, test, iterate. The goal of innovation is not always to achieve perfection immediately. It's eventually that you get there where you have a deployment that works. So if you want to do something meaningful, healthcare is a great place, because using the words of Steve Jobs, seek something where you can make a dent in the universe, because we have a real pain point. It's not always shiny, but we can have an impact on people's life.
I think the inherent thread of all the 3 points you made, it's learning, learning, and learning. And that's a journey, and that never stops.
Thank you. And if I may add to that, American culture, in a way, it's also cultural, is very much about failure. You make a failure, you get up and you do it again. Other cultures are not like this. Many European cultures, for example, where I grew up, failure is not really tolerated. But and that's why maybe the US in many ways is more entrepreneurial and more innovative, because the society allows you to fail. But this is really the most important, is learn and move. It's not a straight road where you innovate, you have an idea, a vision, you execute a goal. It's a zigzag line going forward, and that includes a lot of failure. But the other advice I would really give is listen to your own guts. If I would have listened to everybody who gave me advice, and I do listen because I try to get lots of different perspectives, but at the end of the day, you're accountable, you're responsible, and also listen to your guts, to what you actually think is right based on your knowledge level.
Awesome. Thank you very much for that great advice. And sometimes you want to make a difference, and you can't make a difference if you just follow the same path. So you have to follow your gut sometimes, which is opposing everything which is normal. And then you go make a difference. Awesome. So as we come to the end, Astrid, I'll give you 90 seconds. You can take 4 minutes if you want.
Good. Give me 4 minutes. I take 4 minutes.
If there is something that we missed, or if you think that if there is something that you want to reiterate, you think is super important, this time is yours and it's an open question. Astrid.
Thank you. Actually, I would like to continue with my reiteration on what I said earlier. It's follow your guts. It's listening. It's extremely important. Listening is learning. But my companies, as I said, wouldn't exist if I would have listened to every naysayer and say, no, it can work and it's not, and why are you doing it? So you must follow your dreams and pursue your vision. And that is a very, very important foundation. As I also mentioned earlier, healthcare is one of the toughest and most complex industries you can work in, but also because of its regulations, but also about the risk involved. One wrong decision or one wrong result of a product, especially in the diagnostic sector, has extreme consequences. But it's also a slow-moving industry, and it's full of friction. So it's tough, but at the same time, it's extremely meaningful. We're not building in healthcare technology. We are addressing one of mankind's really biggest needs. We have a growing world population, we have an aging world population, facing actually more diseases. So in order actually to solve that, we desperately actually need healthcare. That means actually, as I said, how challenging it really takes resilience. And most of all, it takes belief in believing in the problem, believing in the ability to solve it, and believing in the path that you have chosen to move forward, even when others don't see it. So it's all about resilience. So my message is to entrepreneurs, stay grounded, stay curious, and trust in yourself and try to ignore the noise all around us, because that's really how innovation happens. Innovation happens because you take the risk of exploring new ideas and you are allowing to look beyond what is currently there and what others can see. Stay curious and follow your passion.
And I will take that advice to my heart, Astrid. As an entrepreneur in my own business, I think I'll start seeing beyond. I'll try to start seeing beyond the trend, and I'll stay true to my purpose. Thank you very much.
Okay, thank you.
Thank you.